everyone. I hope that you all are doing fine. And we will start with this topic today, which is the antibiotic prophylaxis for dental procedure. It is very important because there are some scenarios where you need to prescribe antibiotic dose 1 hour before the procedure. Okay, so we will see in what scenarios we need to prescribe that dose. But before starting this topic, I want you to understand that be very, very, very conscious when you are prescribing any antibiotic to the patients, because in Australia they are very particular when to prescribe, when not to prescribe, and they are very, they are very serious about this topic, that there should not be any misuse. Okay, so overuse of antibiotic use for dental procedures. Only use antibiotics before a dental procedure if there is a clear indication for their use. So we will be reading here surgical antibiotic prophylaxis, for example, for the certain procedures that you need to prescribe the antibiotic for every patient. It is because of the surgical, the treatment you are going to do. Okay, so we will read like in what procedures we need to prescribe. Then there is a topic of infective endocarditis. In that case also we need to prescribe some antibiotics in certain group of patients, and while we do the certain scenarios or certain dental procedures. So we will read that in detail. And antibiotic to treat acute and odontogenic infection, we already covered this topic before in the previous pages, and you should be very thorough, like if there is any localized infection, do you need to prescribe or not, or when there is spreading infection, do you need to prescribe, which dose do you need to prescribe, which antibiotic, the how many days, and what are the doses. Okay, so in this topic we will study these two things, and this is already done. So we will start with the surgical antibiotic prophylaxis in dentistry. Indication is they are very rarely indicated. The recommendation to use surgical antibiotic prophylaxis are informed when possible by evidence that prophylaxis is beneficial for the relevant procedure and patient group. Furthermore, the potential benefits of preventing post-operative infection with surgical antibiotic prophylaxis is balanced against the harms of antibiotics. So you need to weigh the benefits and the harms of antibiotics, because if the patient would take the antibiotic, there would be certain side effects, which are the diarrhea, rashes, and the resistance. And the benefit is it can play a little bit of role in preventing post-operative infection. The role of surgical antibiotic prophylaxis for patients with profound immunocompromise. Which patients are the profound immunocompromised? And stage kidney, liver, HIV, and all the other patients where the immunity level is low, who are undergoing an invasive dental procedure, is uncertain. So we do not know how low their immunity is, so there the indication is very uncertain. So always discuss to their treating specialist about those patients before performing any procedure. Even if surgical antibiotic prophylaxis is not indicated, consider the need for treating an acute treating need for treatment of acute odontogenic infection or infective endocarditis. Look, so it is very thorough. Like for here, this is a table where they have given like these are the procedures, and these are the things that do you need to prescribe the surgical antibiotic prophylaxis. So for almost all of these surgeries or these procedures, they said no, because only for the immunocompromised patient who has the profound immunocompromise, only for those patients we need to discuss with their specialist, but otherwise we do not usually prescribe any antibiotic for the patients. And same goes with the prosthetic joints or the breast implant. If they have any prosthetic joints or the breast implant, this is true that for procedures that commonly cause bacteremia, the potential adverse effects outweigh the potential benefits of prophylaxis. So, even if the patient has any pre-existing joint prosthesis or he has any pre-existing breast implant, you should treat them like a normal patient. If there is any indication to prescribe the antibiotic in the normal patient, then only you would prescribe them. There is no such thing that it would make them more prone to getting the infection and you need to prescribe the antibiotics for them. Okay, and it is also an scenario, a part in which they ask you that the patient has got pre-existing joint prosthesis. Will you prescribe the antibiotic prophylaxis for them or no? So there is nothing that this prosthesis can change in the normal patient. So there is no need to prescribe them. Okay, and do not use prophylactic antibiotics to prevent the dry socket, because you know dry socket is not an infection, so there is no role of antibiotics to play here, which is a post-extraction complication and that is caused by premature clot lysis rather than infection. If prophylaxis is indicated, you need to follow this principle. Although it is very rare that you need to prescribe the surgical antibiotic prophylaxis, but if in certain scenario you need to do that, then you need to follow these principles, which means that there should be a clear indication for its use. Secondly, what antibiotic would you give to the patient? The choice of antibiotic is also important because that will determine by the susceptibility of the organism. For example, if the patient has facial swelling, so the facial swelling, it means then the anaerobic bacteria are playing much bigger role. So you need to prescribe the patient amoxicillin plus metronidazole as well. Okay, so and certain patient they are already taking any antibiotic from other indications, so you need to weigh the benefits and harm and you need to correlate with that. If prophylaxis is indicated, a single preoperative dose of antibiotic is usually sufficient. Okay, and the surgical antibiotic prophylaxis must be administered before surgical incision. So, for short-acting antibiotics such as amoxicillin, the dose should be administered no more than 60 minutes before the incision. Okay, so there should be clear indication, the choice of antibiotics, single preoperative dose. Like the choice also means if the patient is allergic to amoxicillin, then what you can prescribe them, and there are other scenarios. And even the single dose is enough, and the antibiotic should be prescribed no more than 60 minutes before the incision. So the antibiotic choices for surgical prophylaxis in dentistry, it is rarely indicated and only for the profoundly immunocompromised patient. If they are undergoing any invasive procedure, you need to consider a single preoperative dose of narrow to moderate spectrum penicillin, that are benzyl penicillin and the amoxicillin. And the clindamycin is an suitable alternative if the patient is hypersensitive to the penicillin. Then the choice of the antibiotic for the surgical prophylaxis may not need to be altered in patients who have recently received antibiotic therapy. So even if the patient has received a short course of antibiotic within the preceding 4 weeks, there is no need to modify your antibiotic choices. Even if the patient who have recently received surgical antibiotic prophylaxis, there is no need to modify. And even in the patient who are taking long-term antibiotic for another indication such as rheumatoid heart disease, there is no need to modify the surgical antibiotic prophylaxis choice. Okay, so for the normal patient, you can prescribe them either amoxicillin or benzyl penicillin. But if he is allergic to penicillin, then the clindamycin would be a better alternative. Okay, but it is very rarely indicated, and only consider prescribing the surgical antibiotic prophylaxis in patients who are profoundly immunocompromised and discuss with their specialist. Okay, and today or like day after, we will start with this topic, which is the infective endocarditis. Thank you so much, guys, for watching my video, and I hope to see you guys in my following videos. Thank you. Have a good night.